Hello, this is Dr. Hennessy again. I'm giving an update on the COVID situation. Today's Mother's Day, May 10th, 2020. All right, so it's been quite a while, probably a month or so since I made my first little podcast video commenting on the situation. At that time, a lot less was known about the virus and the situation. In that video that I made, I quoted statistics from China that now that probably has to be taken in a different light. I was taking them at face value at the time, and now it's pretty obvious that China has not been forthcoming in the numbers. I mean, that's just something that you have to conclude. That they would have 80,000 cases in the whole country, and that the virus would not spread outside of Wuhan, China, which it's not a credible claim when it's certainly was able to spread to the whole rest of the world. All right, so those numbers probably can't be taken at face value. Other than that, a lot of things have changed. Most places in the world went into a lockdown, which I wanted to comment on that. Okay, so I've been looking at all the various scientific reports and studies because I get the New England Journal of Medicine COVID update reports daily, and I've been looking at this since the beginning. Also, I've looked at various countries and what they've done, and not all of them. Obviously, it's not pretending to be a comprehensive evaluation, but looking at several different countries and different approaches. And I think pretty much I'm going to give you the conclusions that I've drawn so far as to what has happened. So, for one thing, the bottom line conclusion is I don't think it's made a whole lot of difference what's been done. Because you can look at different countries with different approaches. You can find some countries that had a minimal or lesser lockdown approach, and you can find a country maybe nearby even that had lockdown and had better results. Or vice versa. You could find a country that didn't lock down and had better results than a nearby country that did lock down. I think there's going to be a lot of other variables that are going into that. Long and the short of it is, I don't think it really makes any difference what they did. I mean, common sense would tell you that maybe the spread was slowed a little bit by having people locked down, but that may not be true either. In science, we have these rules about testing hypotheses and having controlled experiments. That's why when you have drugs, you have a placebo-controlled study, or you have a study with or without the drug, and control for the variables as much as you can. We've got no such thing going on here. No variables are controlled. We don't even know what the variables are. For instance, so the drug Plaquenil, hydroxychloroquine, so that initially was touted as a possible hope for treatment of the coronavirus, and there were anecdotal reports, somebody saying, I was really sick and then I took Plaquenil and I got better. Well, that sounds real convincing, doesn't it? But actually, that's not real unusual, and it may not be convincing. In my practice over the years, I've seen a lot of cases of viral sore throats where the person got an antibiotic. They'd been sick. Maybe they were at the worst of it, on the 6th day of the sore throat or something. They got the antibiotic, and whoa, next couple days they got better. Yeah, but they were going to get better anyway. I mean, so just because the time association of two things, temporal association, is not really that convincing of an argument. However, anyway, so things should be tested. But one thing that really kind of can't be tested is, what would this virus do if we hadn't done anything? All we have is a lot of dire predictions and and assurances that exponentially more would die. But we don't really know that. We don't know that. We have no idea whether what we've done has had any effect. You look at a so-called non-lockdown country, Sweden, and looking at their rates and numbers compared to lockdown countries, not significantly different. But then Sweden will say, yeah, but we had social distancing and things like that. But we don't have any evidence that social distancing makes any difference. We don't have any evidence for any of that, because we don't know exactly how this virus spreads. They have some experiments showing that the virus is airborne. Okay. Then you look at where did they find this? They found this at hospitals that were treating COVID patients in high traffic areas around those hospitals. Okay. Does that translate to the viruses floating around at the beach? No. And even they had to say, well, they didn't know if the virion particles, they didn't even know if they were infectious. Another small little unspoken fact is that coronaviruses can infect you not just through the nose, but through the eyes. So if your eyes aren't completely covered, it can spread through contact with the conjunctiva, the lining of the eyes. So people walking around with all these masks, they're not covering their eyes. So the idea that you'd be protecting yourself from the virus by wearing a surgical mask or face covering is ridiculous. But that's really not why we're being told to do that. We're being told to do that because of the studies of exhaled breath, virus in exhaled breath, coupled with some studies that showed that apparently in enclosed situations in families that pre-symptomatic people possibly were the most infectious. But we don't know how they were the most infectious, though. They're just adding these two apples and oranges that we can find it in exhaled breath, and that pre-symptomatic patients could be contagious. Then we knit those two things together without any proof that they're related, and just say, oh well, your exhaled breath could be highly contagious, but we don't know that. In these pre-symptomatic case studies or series, they were family members. They could have easily just wiped their nose and touched something. We have no evidence that it has anything to do with exhaled breath. Okay, and it's possible that it could be. It could be, okay? But that's assuming that everyone walking around is pre-symptomatic with coronavirus, which is ridiculous, because we know that's not true. So the question is any of this reasonable? The answer is no. There are two doctors in California that put up a YouTube video pretty much with compelling evidence, just demonstrating that this wasn't a rational approach. And I think they made a few mathematical calculation errors. So the video was taken down as misinformation, but it's ridiculous. Their conclusions were absolutely correct. They made a couple of math errors which have nothing to do with the validity of their argument, which was absolutely correct. The idea that we don't have any evidence at all, that what we've done has decreased any deaths from COVID. Even the critics who say, well, we could have safeguarded the nursing homes more, that's probably true. Because if you look at Australia, they've had like 97 deaths and 65 of them were in nursing homes. But they locked down the whole country. I mean, then you have a country like Australia who was so good at putting a cap and containing the virus by contact tracing techniques, but then they locked the whole country down, which had absolutely nothing to do with their success. How? If somebody could just explain how locking down people without an illness stops the spread of the illness is ridiculous. Because all those people that were locked down still had to go to the grocery store. They still had to go outside. I mean, it's just ridiculous that I mean, God bless Australia. They did wonderfully in containing the virus. But then they booted their success entirely by an unnecessary They coupled it with a totally unnecessary lockdown. So there you go. It's like they squandered their success totally. So, yeah, I mean, we don't have any proof really that we've prevented the number of deaths. There's arguments of so-called flattening the curve. Probably what we've done is we've prolonged the pandemic is what we've done. We may have slowed its spread. We may have slowed its spread to some degree. Probably a small degree, but really all that's done is prolonged it. It's still it's still getting to where it's going to go. Really, my argument is we should have just treated this like any other virus. Wash your hands. Do the things that we were always supposed to do. All of the doctors are supposed to be washing their hands between patients anyway. Surface disinfection, that's supposed to always be done. I could have seen a campaign to remind medical personnel of hygiene techniques, proper infection control techniques that really are no different than they've always been, and just use them. That's what should have been done. And understand, people die every day. That's the thing. 1,200 people died today. So what? Look, 1,200 people die every day. I mean, the idea that you're going to stop life because some people are going to die, then you just have to stop life always, because some people are going to die every day of something. And that's the other thing too, is like cause of death. I just wanted to point out, of course, the CDC, even people have used the number of flu deaths every year as an argument that this isn't that much different, and it's probably true, but you have to remember that it's the CDC's interest to always exaggerate the number of deaths from things like flu, which that's what they do every year. Anybody who dies of pneumonia during flu season is an influenza death. It's in their interest to have high numbers for the things that they're controlling. I mean, that's just human nature. It's just what they do. So, again, you're probably going to see an inflated number of COVID deaths. How much doesn't really matter how inflated it is. People are dying of it. But people are dying of all kinds of respiratory illnesses every year. ARDS, acute respiratory distress syndrome. I mean, I said this in my last video. A lot of people, 190,000 people get that a year from all kinds of different viruses. Look, it happens. Nobody's happy about it happening. I've taken care of ARDS patients in ICUs. I know what it's like. It's a very, very stressing and difficult situation because really there's nothing you can do. At any rate, that's my take on it, looking at all the numbers, looking at the various places, the various approaches. Essentially, I mean, yeah, if all the numbers and truth was known, it's my belief that the harm from what we've done so outweighs the benefits that it's not even close. This would be like if this was a clinical trial, it would be stopped at the first analysis point because people would be dying. Yeah, it's like you're doing a clinical trial and 70% of the patients are dying. You stop the trial because it's obviously what you're doing is worse. But here, what we're doing is we're not stopping the trial, even though we have absolutely no evidence that what we're doing is doing any good other than the assurances that, trust me, I'm an expert. It would have been much worse if you hadn't done this, but there's no evidence whatsoever that it would have been much worse, except for the lockdowns. There's no evidence that social distancing does any good. There's no evidence that covering your face does any good. There's no evidence that people not going to work at a normal job does any good. None. So that's the take home on this one. We'll probably do some other videos later. Have a good day. Happy Mother's Day.